John, how are you? This is a new question of orthopedics. A 25 years old ski instructor falls off a ski lift and sustained spiral fracture of the midshaft of the tibia. So the 25 years old ski instructor suddenly fall and development of fracture of the midshaft, which is spiral in shape, and there is attempt to reposition of the bones by the plaster, but the plaster is failed. Overlying tissue are healthy, that means there is no laceration or there is no gastrilo type of injury. What is the most appropriate course of the action? That means the patient which is a closed fracture, and the fracture in the midshaft of the tibia, and it is a spiral shape. So what will be our management? The options are amputation, open reduction and fixation using a long plate, intramedullary nail, skeletal traction, and long limb casting. First of all, let's see the intramedullary nail and the plate and the screw. Here we can see this is in the first picture. This is an intramedullary nail, and this intramedullary nail, it is inserted at the level of the tibial tuberosity. So in case of the tibial tuberosity, there is intramedullary nail inserted in the first and second picture. Second picture also, here we can see this is the intramedullary nail insertion. This picture here you can see this is the screw and plate of the tibia, and here this is the screw. This is the screw and plate which is inserted. So what may be the options? The options, first of all, let's see the key point of management of the fracture. First of all, the immobilize the fracture, including the proximal and distal joint. So this is very, very important. That means for stabilizing any type of the fracture bone, what we will have to do, we have to immobilize both the proximal part and the distal part of the bones. The monitor neurovascular status, that means the vascular status and the nervous status following the reduction and immobilization, and also the management of the infection, including the tetanus prophylaxis. In case of the open fracture, the tetanus prophylaxis should be given, and also in this case IV broad spectrum antibiotic also given. In case of open fracture, there is thoroughly debridement done, and in case of open fracture emergency, it is the very emergency and should be debrided and lavaged within 6 hours of the injury. So what may be our option? Our option is the intramedullary nail, because it is the oblique fracture. This is the oblique or spiral fracture, and there is no displacement. Here we can see there is in this question there is no option of the displacement, and there is no displacement, so there is a best option of intramedullary nail, because in case of intramedullary nail there is injury is very less, or cut point is the very small. But in case of the using plate or screw, usually the wound size large, so all time we have to reduce the wound size. And for this condition, as there is no displacement and spiral fracture, so in this condition the best option is the intramedullary nail.